Welcome back. My next guest is Dr. Andrew Todd, who is a urologist with the Lexington Clinic. Welcome. Now, I said I think this month is Men's Health Awareness Month, and you're a urologist, so tell us what a urologist does in relation to men's health.
Sure. Well, so a urologist is a surgeon, primarily of the genitourinary organs. So we're talking about bladders, kidneys, prostates. Now, we take care of men and women. 50% of my patients are women, but we do take care of a whole gamut of men's health issues, ranging from cancer to testosterone and men's sexual health to continence to urinary problems.
Now, one of the things you mentioned is prostate, and that's what Men's Health Awareness, it seems like everybody ends up focusing on that because it's a big deal.
Yeah, Movember.
That's right. So what are some symptoms that may think, oh, I'm having a problem?
Yeah, and it's interesting, a lot of men come to see us after things have kind of been going on for a long time, and it's sort of, they start to think that's their new normal, and a lot of those things aren't normal. Having to get up 4 or 5 times at night to go to the bathroom is not normal. Having urge sensations where if you don't make it to the bathroom in time, you're gonna wet yourself. That's not normal. And those are certainly alarm symptoms to come in and see us. Weak stream, struggling to get the urine out, having to strain. Those are all reasons to come see a urologist.
Okay, so let's assume they do come see you. Tell me some of the things you might do to make a diagnosis.
Yeah, it's great that you asked that. It's interesting, 15, 20 years ago, we only had a couple options. We had medicines that guys could take for indefinitely, and then we had surgeries that were bloody, required a hospital stay, were more invasive. Now we have so many different options that we can do for men to treat BPH or enlarged prostate. And it really can range from how severe are their symptoms, what are their goals, what are side effects that they're looking to avoid. And I think that it really starts with taking a good history and physical exam and doing an evaluation, assessing the size of a man's prostate. Is it obstructing them? Could there be other things like cancer or stricture disease or stones that could be causing the problem? And evaluate their bladder health too.
So it could be all those things, but the two of the big ones are BPH, prostatic hypertrophy, and a lot of people worry about cancer. But let's talk about BPH for a minute.
Yeah.
What are some things you do to treat that surgically?
Yeah, so at Lexington Clinic we offer all the treatments, and one of my subspecialties is in BPH. So things that I offer include medical management, minimally invasive surgical technologies like UroLift, and other minimally invasive surgeries like HOLIP, or holmium laser enucleation of the prostate, which is one of the most durable, minimally invasive outpatient surgeries for the prostate, as well as some of the newcomers, the new technology that's out there. We're very excited about, like aquablation. We now offer that at several hospitals here in Lexington.
And you mentioned several of those things are outpatient, you're home the same day.
Home same day, just have a catheter overnight, comes out the next day.
All right, now, I also mentioned prostate cancer.
Yes.
So tell us how that diagnosis is made, and maybe talk a little bit about the PSA pros and cons.
Absolutely, and PSA has a long history. We started doing PSA screening in really the early 90s, and it changed the paradigm where no longer were men coming in where they already had metastatic prostate cancer. And so we were screening, we were catching prostate cancer when there are no symptoms, and that's the goal. We were getting a little over-aggressive, I think, in the early 2000s with prostate cancer treatments. So the pendulum kind of swung the other way, and the USPSTF recommended against prostate cancer screening, more or less, around 2008. But since then, they've seen that the data clearly shows a survival benefit with screening for prostate cancer. So we strongly recommend all men, get screened appropriately for prostate cancer and come and talk to their primary care doctors or their urologists about that, because it really does have a survival benefit. Being screened for prostate cancer catching it and treating it if it needs to be treated. Not all of them need to be treated early before it spreads.
Now, so some of them you can do, I guess, what they call watchful waiting, but there are also some other treatments, surgery, radiation as
Absolutely.
options.
Yeah, and we have all those treatments at Lexington Clinic too, ranging from the two traditional mainstay FDA-approved treatments at this point are surgery, minimally invasive robotic prostatectomy, and external beam radiation therapy, or SBRT or CyberKnife, which can be as little as 5 treatments. Now there's other treatments as well that are less invasive that can be used for lower or intermediate risk prostate cancers that some of my partners offer, like NanoKnife, that are really fascinating and very new.
Well, that's great information. We appreciate you coming in and sharing all and all you do for men's health.
Thank you so much.